Hi there, this is Dr. Belitz, and welcome to a hopefully very exciting and informative edition of the Ask Dr. Jack show. I'm Dr. Jack Belitz, chiropractor extraordinaire in Omaha, Nebraska, and I am here to answer the questions that you ask. Today, we are going to discuss a question that a patient came in last week with, and that is the evolving question of, my doctor wants to put me on a statin, in other words, a high cholesterol medication. Should I do it or not? Well, let me just start out by saying, I am a chiropractor. I'm not going to give anybody advice on medication because that is not my deal here. What I am going to do is provide you with the other side of the story so that you can make an informative decision about your own health when you have both sides of the story. And today, in order to do that, we are going to bring in a phenomenal study that was done a couple of years ago now. And I think these are important because, if somebody's going to take the time to do all this research, you should be able to have that information so that you can decide if it helps you make a decision. So this particular study was done, and the authors looked at various studies published between 2000 and 2013. So that's a 13-year span, and they got some incredible data on it. And they studied, the studies included both men and women, and they all had concomitant risk of factors for diabetes. Which means, there's a little bit of a chance that there's diabetes in their family, all that kind of stuff. Anyway, they say that the current available clinical data suggests a possible association between statin use and the incidence of diabetes. Well, what does that mean? Well, what that means is that they were noticing some pretty significant association between the fact that some people who were taking statin medications were getting diabetes as a result. That's huge. So if you're sitting there and your doctor wants to put you on a statin medication and you have absolutely no history of diabetes in your family, you don't gain weight at all in your stomach, you just not even a factor of it, well, then you have to maybe look at other studies to decide whether or not that is something for you. However, if you do have any of those factors, this right here is a study that you should really consider looking at. What you have to understand is that most of the studies that are done are funded by drug companies. And these drug companies have a very, very, very important factor in their life, and that is that they want to make a profit. So they're always going to make sure that these studies are favorable towards their product, or else they're not going to do the study, which, hey, that's cool. I mean, they have a very vested interest in this. They have they really need to do this for their shareholders. All right, it's what they have to do. So, if you do have somebody telling you that your cholesterol is a little high, first of all, look at your diet. And I'm not saying look at the cholesterol in your diet, because a couple episodes ago, we kind of debunked that whole myth. Look at the one about eggs. Look at the amount of carbs in your diet. If you have a diet high in carbs, that's going to be the biggest factor in how much cholesterol you have going on there. Another thing, what we are finding out is pomegranate juice is amazing at helping keep cholesterol under control. So try that first. Silly not to. What have you got to lose? You can buy there's this palm juice over at Walmart, for gosh sakes. You don't have to buy anything real fancy. It's pretty easy to do. So anyway, that's the episode for the day. Be very careful with statins. There are so many things on the internet everywhere that tell you how many terrible things are happening to people under statin medications. There are a lot of other options out there. Now, you might have to go on that, and you do have to make sure that you pay attention to those numbers. But for gosh sakes, try all the other stuff first. A good chiropractic regimen would be really important, that also, because if your body is functioning right, then it's going to do the best job it can of keeping your cholesterol under control. If all of those factors fail, yeah, you might have to look at that. But make sure that you look at everything else first. If you have any questions about that, if you want to know if there are things that you personally can do, call the office, 402-333-4848. Schedule a consult real quick. Mention this and we'll do it for free. How can you beat that? If you have any questions for me that you would like to ask on the show, call that number. Or ask Dr. Jack B, that's BEE, at gmail.com, or come on in. Thank you very much for listening. Have a healthy and happy day.